The 1990s. Affected by the earthquake, economic crisis, and the Karabakh conflict, the Republic of Armenia was taking its first steps to reform the healthcare sector. The Soviet health management and financial system was paralyzed. And the government of Armenia started to implement health sector modernization projects with the support of the World Bank. (1997 to 2003), health financing and primary health care development, more than $12 million. 2004 to 2015, health system modernization. First stage, about $26 million. Second stage, about $27 million. Third stage, more than $25 million. 2013 to 2019, disease prevention and control, $45 million. The primary healthcare reforms have had the following results. Family physician services have become accessible for 85% of the urban population and for 100% of the rural population. 1,676 doctors and 1,804 nurses were specialized. 145 practical guidelines for provision of primary healthcare services were developed. In addition to 76 rural community medical facilities, which were modernized during the first project, 97 rural ambulatories were constructed and renovated. For about 630,000 rural population, the services have become accessible in the new ambulatories. For example, previously the ambulatory of the remote Voskevan community of Tavush region was operating in the old building of a kindergarten. In 2015, with the support of the World Bank and a 5% investment from the community, a new ambulatory was constructed in Voskevan, which also serves the neighboring Baranis and Voskepar rural communities. This building offers the right service to the population. Furthermore, every such construction in remote villages inspires faith for a brighter tomorrow and for the future. The ambulatory is equipped with furniture and equipment and provides quality and affordable primary health care services to the 3 distant communities. The people in the village are visiting us. They're glad to come here. They don't need to go anywhere else. With its cleanliness and its convenience, here it is good for the patients. For quite a long time, we've worked under extremely unfavorable conditions. Now it's a pleasant atmosphere. In fact, working has become easier. Referrals have also increased. The investments in Voskevan ambulatory amounted to $117,000. It serves 3 communities with a total population of 3,500. One of the objectives of the hospital system reforms was the optimization of resources without reducing the specialists, the decrease of expenditures, and the existence of at least one modern hospital in each region, and provision of the full package of medical services for residents in the region. The investments in the hospital network till today have amounted to $61 million. Between 2008 and 2015, 2 new medical centers were constructed in Gyumri and Mehri cities, and 12 medical centers were reconstructed. The flow of people to medical centers has increased. The number of surgeries conducted in the regions has also increased. The modernized medical centers serve about 830,000 people.
Չէ մի վախեցի։ Չի ցավում։ Չէ։
Gavar Medical Center started to operate in November 2011. It is equipped with modern diagnostic and treatment equipment, also offering new services.
Հիմա մի քիչ թեքվում եք դեպի աջ։
Մասնագետները, որոնք որ չունեին մինչև այդ։
Before the renovation, we didn't have medical specialists and modern equipment.
Հետո ունենք։
Actually, the trust of the population towards the hospital and the doctors has increased. I could afford to go to Yerevan and even outside of Yerevan to undergo surgery. But here it is convenient for me. It's better for me to be in our country, our land and water, where our relatives and everyone is next to me. The way things are going now, tomorrow or the day after I will. Or why should I go? It is indeed a good place to stay. As a result of the modernization, a modern dialysis department started operating in Gerardkunik region for the first time. The social problem of sending patients to the capital city for treatment was resolved. For a long time, my husband suffered from kidney disease. After that time, he received treatment for 2 years in Yerevan. Since the center opened here, the situation has improved for the patients. A lot of financial resources were needed for transportation, but the patients were not able to afford it. Sometimes their blood pressure is high, then low. Sometimes they feel sick. That's why staying here is very convenient for us. The investments in Gavar Medical Center amounted to about $4 million. The center provides services to about 254,000 people from Gerardkunik region. As a result of the investments, the number of treated patients has increased. World Bank projects contributed to health sector policy development, transparent governance, and to the introduction of new services. Gyumri Medical Center was established as a result of the merging of 3 hospitals. This is the first newly constructed regional multifunctional hospital since the independence of the Republic of Armenia. There were neurology patients here who were sent to Yerevan for tomography, but now we have computed tomography in our hospital, and all you have to do is to refer them to the first floor. Since operations began, more than 30 new narrow specialists have started working here. The medical staff and the number of surgeries have increased. After the new hospital construction, we are utilizing equipment and services that never existed in the region before. A good example is computed tomography. The regions couldn't even dream of invasive cardiac intervention previously. The center currently offers angiographic services, diagnosis and treatment of coronary arteries. How was the surgery? Very well. If it wasn't here, if it was in Yerevan, I might not have made it on time. What's important is that you're doing well. Yes, bless you. A number of services were offered for the first time in Shirak region, including endoscopic surgery, immunoassay laboratory, treadmill, and multifunctional X-ray examinations. The investments in Gyumri Medical Center amounted to about $14 million. The center provides services to the 282,000 population of Shirak region. Currently, the Ministry of Health of Armenia, with the support of the World Bank, is implementing a new project aimed at the early detection and prevention of non-communicable diseases that are the leading cause of death in Armenia: hypertension, diabetes mellitus, and cervical cancer. In Armenia, the mortality rate for cardiovascular diseases is about 48%, for malignant neoplasms 20%, and for diabetes mellitus 4%. Under the Disease Prevention and Control Project, the screenings are implemented free of charge for the population at the primary healthcare facilities. Screening of diabetes mellitus, 35 to 68 age group. Screening of hypertension, 35 to 68 age group. Screening of cervical cancer, women of the 30 to 60 age group. Under the Disease Prevention and Control Project, the following activities are included: modernization of the Hematology Center with establishment of the bone marrow transplantation and high-dosage chemotherapy department, and stem cell laboratory of regional significance. Establishment of a modern radiation treatment center. Construction of a new medical center in Sevan. Renovation of the Artashat Medical Center. As a result of the investments, the health system has significantly improved and continues to be improved, and the quality and accessibility of services have increased not only for the population of the regions in Armenia, but also for the capital city.